Okay, my name is Dominique Garcia. I'm going to be performing a postpartum physical assessment today. So I'm going to go ahead and begin with the patient's vital signs. I'm going to start off with the patient's apical pulse. Okay, so upon auscultation, I heard no murmurs, no gallops, and a normal S1 and S2, as well as her having 62 beats per minute. I'm going to go ahead and auscultate the lungs now, as well as the respirations. And take one deep breath for me. Okay, so the respirations did come out to 18 breaths per minute, and there was no adventitious sounds as well. I'm going to go ahead and assess her blood pressure. I'm going to go ahead and put the blood pressure cuff on. Okay, so her blood pressure did come out to 122/78. I'm going to go ahead and assess the temperature orally. So I'm going to ask you to open your mouth and lift up your tongue. Okay, you can close your mouth now. Okay, so the temperature did come out to 98.7, and now I'll go ahead and assess her pain on a scale of 1 to 10. What would you rate your pain at right now? A 2? Okay, that's fine. Okay, so now I'm going to go ahead and assess if she has any CVA tenderness. Let me take this cuff off of you. Okay. I'm going to ask you to move forward. Okay, so the patient does not complain of any pain upon the CVA tenderness assessment, therefore indicating no kidney infection. So now I'll go ahead and assess the patient's breasts. So upon palpation, I can go ahead and feel that they're filling. The patient does have smooth and even pigmentation. There is skin changes with pregnancy. So now I'm going to go ahead and move on to the uterus. I'm going to go ahead and palpate for the fundus. Okay, so the fundus is firm. Okay, so now I'm going to go ahead and move on to the bladder, which is not palpable as well upon upon palpation of the fundus. Now I'm going to go ahead and assess the patient's bowel movements. Okay, when was the last time you had a bowel movement, Miss Susie Q? Okay, yesterday, last night. Okay, I'm going to go ahead and listen to her bowel sounds. All bowel sounds are present within all 4 quadrants. I'm going to go ahead and assess the lochia now. Okay, there appears to be no redness, no edema, no ecchymosis, no discharge, and the edges are within approximation, which are all normal findings and what we're looking for. So now I'm going to go ahead and move on to the Hogman sign. Okay. Okay, I'm going to go ahead and grab the patient's right leg, and I'm going to go ahead and extend it as well as the foot. I'm going to massage the calf. Is there any pain? No? I'm going to do the same with the left, extending the leg and the knee as well as the foot, massaging the calf. Any pain? No? Okay. This indicates the negative Hogman sign. So now I will go ahead and move on to if the patient has any edema. So upon assessing for the Hogman sign, I did not see any signs of edema on the lower extremities. So now I'm going to go ahead and move on to the upper extremities. Okay. Okay. No signs of edema. Now I'm going to go ahead and assess for the deep tendon reflexes in the foot. Okay. I'm going to go ahead and extend your feet. Can you go ahead and, flex your feet. Can you go ahead and extend them for me and push against my hands? Okay. So the patient has a brisk response, which is normal. It would be a 2+ with no clonus. I'm going to go ahead and assess for any skin changes during pregnancy. So the patient does have a striae in the umbilicus area towards the external oblique. And she also has the linea nigra running midline. The patient's activity is assistance upon the first time getting up, and then PRN after that, so as needed. And this will be completing my postpartum assessment.